Did you know that every 6 minutes, a senior suffers a stroke, an event that in many cases could have been prevented? It's a chilling statistic, but behind every number, there's a story. A grandmother who will no longer be able to tell bedtime stories, a father who won't walk through his garden again, a life that fades away in a matter of seconds. And what's most alarming, the reason I turned on this camera with a sense of urgency I rarely feel, is that a recent study has found a direct connection between many of these cases and 4 common medications, drugs that you probably have in your medicine cabinet right now. Medications prescribed with good intentions, but carrying risks that are now coming to light in deeply concerning ways. If you're over 60, or if you care for aging parents or grandparents, I need you to hear this. I'm not exaggerating when I say this. Information could literally prevent a tragedy. Because one of these medications, considered by millions to be as harmless as drinking water, may actually be dangerously increasing, sometimes even tripling, the silent risk of suffering a stroke, also known as a cerebrovascular accident, or CVA. I'm Dr. Bryam, and in my more than 2 decades dedicated to health and healthy aging, I've witnessed how the right information, shared in time, can be the difference between enjoying your later years or becoming fully dependent on others. Today, we won't be talking about vague theories, but rather solid scientific evidence, concrete studies, and a medical truth that sadly many still ignore. I'm going to tell you what those 4 medications are that pose a threat to the brain health of older adults. And even more important, what safer alternatives you should discuss with your doctor. The last one on the list is the most unexpected, and honestly, the one that infuriates me the most. Stay with me, because in this case, knowing the truth doesn't just empower, it saves lives. But before we continue, let me explain exactly what a stroke is. Imagine your brain as a vibrant, bustling city in constant motion. The neurons are the homes, and the arteries are the wide avenues transporting oxygen and nutrients, the essential fuel that keeps everything running. A stroke occurs when that vital traffic suddenly comes to a halt. There are 2 main causes. The most common is ischemic stroke, a kind of extreme traffic jam caused by a blood clot blocking an artery. Without fuel, the neurons in that area begin to die within minutes. The second type is hemorrhagic stroke. This happens when an artery bursts and blood floods the brain tissue, causing widespread damage. In both cases, the consequences can be devastating. The major challenge is that as we age, the brain becomes more fragile. It's like an old computer, powerful, full of experience, but with a more delicate system. It no longer handles chemical substances the way it used to, and certain medications, like the ones we'll talk about today, act like a virus that overloads its functions, disrupting the connections. And the most dangerous part? They do it silently, until the damage is already done. With that image in mind, it's time to uncover what many people don't know. Let's take a look inside the medicine cabinet and shine a bright light on the hidden risks lurking there. First section, the culprit that seems harmless. We're talking about non-steroidal anti-inflammatory drugs, also known as NSAIDs. This group of medications is probably the most common in any household. Ibuprofen, naproxen, diclofenac. Sound familiar? They're the go-to allies for headaches, back pain, or that morning arthritis stiffness. We can get them without a prescription, and many of us use them almost as casually as candy. And that's where the danger lies, in their image of safety. For a young person with a strong cardiovascular system, taking ibuprofen occasionally isn't a big deal. But when it comes to someone over 60 years old, especially if they take these medications daily for osteoarthritis or arthritis, the situation changes dramatically. What once seemed like a friend against pain becomes a silent enemy. And how can something so ordinary pose such a serious threat? It's not just one effect. It's a lethal combination of 3 mechanisms happening simultaneously. The first is its impact on blood pressure. Imagine your arteries as a garden hose. Blood pressure is the force with which blood flows through them. NSAIDs cause the body to retain sodium and water, which increases blood volume. At the same time, they stiffen the artery walls. The result? More fluid being pushed through a narrower, more rigid path. This causes blood pressure to rise dangerously, and hypertension is the #1 risk factor for a stroke. It's like putting too much pressure on your home's plumbing. Eventually, a pipe will burst. The second mechanism is more invisible, but just as harmful. It affects both the kidneys and platelets. The kidneys, your body's essential filters, are especially sensitive to NSAIDs, particularly in people who've lived several decades. When those filters begin to deteriorate, blood pressure tends to get worse. Plus, these medications alter how platelets behave, the cells responsible for clotting when we bleed, and that imbalance can lead to clot formation in the wrong places, like the arteries in the brain. The third mechanism may be the most definitive: atherosclerosis. Prolonged use of NSAIDs keeps the inner walls of arteries in a constant state of inflammation. That inflammation acts like sandpaper, creating rough patches where cholesterol sticks and forms plaques. If a piece of that plaque breaks off and travels to the brain, the damage can be immediate. Imagine a 68-year-old man, retired, who loved tending to his garden. He had osteoarthritis in his knees and took diclofenac, 2 pills a day, every day. "It's the only thing that helps," he used to say. His blood pressure was a bit high, but he didn't pay much attention to it. He didn't know that each pill was adding to the risk. His blood pressure rose silently. His arteries hardened. One morning, while watering his plants, he felt dizzy and dropped the hose. He couldn't move one of his arms. He was having a stroke. The cause was a clot, but the conditions had been building for years due to what seemed like a harmless routine. So, what's the solution? Should we just accept living with pain? Of course not. The key lies in having a strategy. There are diclofenac or ibuprofen creams and gels that work locally, right at the site of the pain, helping to minimize the risk of body-wide side effects. And let's not forget the effectiveness of physical therapy, guided movement, and the use of heat and cold. The real goal isn't just to mask the pain, but to address it at its root, using the safest strategy possible. Having this knowledge allows you to ask the right questions, and those questions may be the key to protecting your brain health. Let's move on to Section 2, a silent enemy connected to an issue almost no one wants to talk about: anticholinergic medications. This group often flies under the radar in discussions about stroke, which is exactly why it poses an even greater danger. It's linked to a common yet highly stigmatized condition: incontinence or overactive bladder. For millions of people, the fear of involuntary urine leakage limits their daily lives. The usual solution? A pill, an anticholinergic drug. Names like oxybutynin, tolterodine, or solifenacin are fairly common. They promise to give back control, and in many cases, they do work. But what few people mention is the close connection these drugs have to brain health. To understand this, we need to talk about acetylcholine, an essential chemical. This neurotransmitter carries messages between neurons and also plays a role in muscle control, including the bladder. But its most important role is in the brain. Without acetylcholine, there is no strong memory, no mental clarity, no smooth learning. It's the lubricant that keeps the gears of the mind turning. So, what do anticholinergic drugs do? They block acetylcholine in the bladder. That relaxes the muscles and relieves the symptoms. But the problem is, they don't work like a laser. They're more like a scatter bomb. They enter the bloodstream and spread everywhere, including the brain, where they also block acetylcholine's function. The result? The most evident and concerning effect is cognitive decline. Prolonged use has been linked to an increased risk of developing dementia. Many patients experience confusion, trouble concentrating, memory loss, drowsiness, and they assume it's just aging. What they don't realize is that that little pill meant to control the bladder may be slowly dimming the lights in their mind. But the risk doesn't stop there. The connection between these medications and stroke is darker than it seems. Acetylcholine also plays a key role in regulating blood flow to the brain. When blocked, these drugs can interfere with the ability of cerebral arteries to expand when the brain needs more oxygen. This can lead to areas with poor circulation, creating the perfect conditions for a stroke. Additionally, side effects like dizziness when standing up or sedation can destabilize a cardiovascular system already weakened by age. It's like asking your brain to manage air traffic control with half the staff and the radios down. An accident is only a matter of time. Let me tell you Marta's story. She's 75, widowed, and used to live quite an active life. Then she developed overactive bladder, and the fear of an accident kept her shut inside her home. Her doctor prescribed oxybutynin. At first, it worked wonders. But over time, her daughters noticed she was becoming more forgetful, more distracted. One day, as she got up from the couch, she felt intensely dizzy and collapsed. What she experienced was a TIA, a transient ischemic attack, a kind of warning sign that a full stroke could be near. When the doctors reviewed her medications, the cause was clear. The very pill that had given her the confidence to go out again was also putting her life at risk. Marta's story is a warning. If you're taking a medication for incontinence, act smart. Don't stop it without medical supervision. The first step is to check whether it's an anticholinergic. If it is, call your doctor and ask the question that could make all the difference. Dr. Bryam, could this medication be affecting my brain? Are there safer options for me? The good news is, yes, there are. There are newer alternatives, like beta-3 agonists, for example, mirabegron. These work through a different mechanism, without interfering with acetylcholine, and they have a much safer profile for the nervous system. And beyond medications, there are effective non-drug therapies. Kegel exercises to strengthen the pelvic floor are highly effective. You can also retrain your bladder by setting regular bathroom schedules. Even small changes, like reducing caffeine, alcohol, or sodas, can make a big difference. Incontinence needs a solution, of course, but never at the cost of your mind. You have the right to demand treatments that protect your brain, too. We've already uncovered 2 of the main culprits. If this information is opening your eyes to dangers that often go unnoticed, I'm going to ask you for something simple but incredibly valuable. Click the like button. Each like tells YouTube that this content matters and that it should reach more people who need it. Your support is the fuel that keeps us researching and sharing. And if you haven't subscribed yet, now's the time. Also activate the notification bell, because the next 2 medications we're about to examine are, if anything, even more important, and you won't want to miss them. Let's move on to Section 3, the miracle remedy with a dark side. I'm talking about systemic corticosteroids, like prednisone or dexamethasone. If you've ever faced a severe asthma attack, a strong allergic reaction, or you suffer from an autoimmune condition, you know how powerful these drugs are. In a matter of hours, they can reduce severe inflammation and restore your body to normal. And because they're so effective, it's hard to see them as a threat. But that power comes at a high cost, especially when used over long periods. Taking oral corticosteroids long-term is like making a dangerous deal, immediate relief in exchange for serious health consequences. And one of the most concerning risks is the significant increase in stroke risk. Why? Because corticosteroids don't target just one area. They launch a multi-front offensive that weakens several body systems. I call it the triple threat of corticosteroids. First threat, hypertension. They cause sodium retention and potassium loss, leading the body to retain fluids. As a result, the heart has to pump a larger blood volume. It's similar to the effect of NSAIDs, but often much more intense. The result, sky-high blood pressure. Second threat, hyperglycemia. Corticosteroids raise blood sugar levels and interfere with insulin. This can lead to steroid-induced diabetes. And having high blood sugar is like bathing your arteries in thick syrup every day. It stiffens them, inflames them, and makes them fragile. Third threat, a dangerous cocktail. These drugs alter lipid profiles by increasing bad cholesterol, LDL, and thickening the blood. This means you now have arteries weakened by pressure and sugar, and thicker blood, ready to form clots. It's the perfect storm for a cerebral disaster. Think of Jorge, 72 years old, living with severe COPD. For years, every respiratory crisis was managed with a cycle of prednisone. Yes, it saved him, but there was never a plan to reduce his dependency. Over time, he developed hypertension, and his glucose levels were always borderline. Everyone focused on his lungs, without noticing the silent damage accumulating elsewhere. One afternoon, while reading, the letters on the page began to blur, and one side of his face went numb. He suffered a stroke. Prednisone wasn't the only cause, but it was the accelerator that pushed his body over the edge. Now we enter the final section, the most dangerous drug of all, and one of the most misused in older adults. I'm talking about antipsychotics. Medications like risperidone, olanzapine, or quetiapine, originally developed to treat serious psychiatric disorders like schizophrenia. In those cases, they are essential tools. But what's alarming is their use outside of those conditions, especially in patients with dementia. In advanced stages of Alzheimer's, symptoms like aggression, anxiety, or behavioral disturbances can be hard to manage. And in an overburdened healthcare system, the fastest solution is often to prescribe an antipsychotic to calm things down. But that decision can be like playing Russian roulette. Regulatory bodies like the FDA have issued their most serious warning, the infamous black box warning, stating that in elderly patients with dementia, these drugs can double the risk of death and triple the risk of stroke. Why? Because their physiological impact is severe. First, they cause orthostatic hypotension, a sudden drop in blood pressure when standing up. This leads to dizziness and dangerous falls, which in older adults can result in fractures and complete loss of independence. What's worse, that drop in blood pressure can deprive the brain of oxygen during critical seconds. Repeat this several times, and you've got a direct path to a stroke. Second, they disrupt heart rhythm, causing arrhythmias that can lead to blood clots that can travel to the brain. As if that weren't enough, they also induce severe metabolic syndrome, raising blood sugar, increasing cholesterol, and promoting weight gain. In just a few months, they can trigger full-blown diabetes. And there's more. Recent studies show they may even thicken the blood, raising the risk of fatal clots. As Dr. Bryam always says, in elderly patients with dementia, these medications should be used only when there's no other option, and always under strict medical supervision. What these drugs literally do is thicken the blood and make it more sticky. Think of Elena, 80 years old with advanced dementia. She was becoming increasingly restless. Her son, desperate, consulted a doctor who prescribed a low dose of risperidone. Elena was calmer, yes, but she also spent almost the entire day asleep. No one realized that her blood pressure was fluctuating dangerously. One afternoon, her son found her on the couch, eyes blank, mouth drooping to one side. She had suffered a severe stroke. The pill that was supposed to help her ended up being her executioner. This is the hardest conversation, but also the most important one any caregiver must have. If your loved one with dementia has been prescribed an antipsychotic, you must be their advocate. Ask the doctor firmly. Dr. Bryam, I'm aware of the black box warning. Have we explored all non-drug options? What's the plan to discontinue this medication as soon as possible? Because yes, there are other options. The first step to managing agitation in dementia should not be medication. We need to investigate what's behind it. Often, agitation is a signal that something is wrong. Pain they can't express, an infection, fear, boredom. The key lies in behavioral interventions. Creating a calm environment, playing familiar music, simplifying routines, validating emotions. These strategies require time and patience, much more than a quick prescription, but they are infinitely safer and more respectful. Antipsychotic use in older adults with dementia should be the very last resort, used only when all else fails and for a very short period. It should never be a matter of convenience, because the cost, far too often, is a devastating and entirely preventable stroke. We've come a long way. I know. We opened the medicine cabinet and exposed 4 enemies hiding in plain sight. NSAIDs like ibuprofen, painkillers that can damage your arteries, anticholinergics for incontinence, which slowly dim the lights in your brain, corticosteroids like prednisone, a dangerous bargain, quick relief at a high price, and antipsychotics, a quick fix for dementia that multiplies the risk of the worst possible outcome. But today's message isn't meant to scare you. It's meant to help you regain control. We've put too much trust in a healthcare system that sometimes, out of haste, chooses the easy pill. But you are not a passive patient. You're the conductor of your health's orchestra. The knowledge you now have is your most powerful tool. The ability to ask the right questions, to open a dialogue with your doctor, not just listen to a monologue. Don't walk away with fear. Walk away with a plan.